Good afternoon, and thank you again for joining us for today's webinar, CMS Update New Medicare Card Campaign. Today's presenter is Ms. Feierman. Ms. Debbie Feierman works at the Centers for Medicare and Medicaid Services, CMS, Regional Office on the External Affairs team. She conducts outreach and educational presentations on Medicare and the health insurance marketplace. Debbie also works with state, federal, and local organizations to develop partnerships and collaborate on opportunities to bring health care information to the public. Prior to joining CMS, Debbie was the director for children's health insurance programs for a national healthcare company, managing their CHIP and Medicaid health plans. Ms. Feierman received her master's in social work from the University of Pennsylvania. Debbie's postgraduate career began as a clinical social worker and coordinator of psychosocial support programs in pediatric oncology and hematology at Cooper Hospital University Medical Center in Camden, New Jersey, and Fox Chase Center, where she developed psychosocial support services, including a school reentry program, Camp Happy Times, and a variety of support groups for patients, siblings, and families with a child living with cancer, as well as direct patient care. Thank you, Debbie, for presenting today, and I'll hand the presentation over to you.
Thanks, Colleen, and thank you very much for the lovely introduction. Good afternoon, everybody. I want to thank you for spending part of your afternoon with us, and I appreciate your interest in hearing about the new Medicare card. I'm going to provide you with some information. Some of it you may have heard because we've been doing this campaign for a little while, and the drum beat's getting a little louder. But before I do, I just want to again acknowledge the Housing Alliance for hosting us, and certainly appreciate your partnership with that. One housekeeping detail that I want to do is to say this is an informational webinar. It's not intended to be official guidance. So I would refer you to our cms.gov website that does house all our official guidance and regulations. And it is also not intended for the press, although the press are very welcome to listen. If they have questions, I'm happy to refer you to our media affairs officer, and you can get all your questions for any press material through the press office. So with that, I'm going to get started and talk about the Medicare health insurance program and some changes that are coming with regard to the new cards that are going to be sent out. And I say that, I distinguish that because I do want to say that there are no benefit changes that are associated with this card. So the benefits still remain the same. This is an initiative that's done out of a result of some legislation that I'll be telling you about, but it is intended primarily to secure the safety and identity of Medicare beneficiaries. So Medicare is currently a federal health insurance program that covers about 59 million Medicare beneficiaries. And I would say the people that fall into the eligibility category for Medicare are folks who are 65 and older, or under 65 and disabled and determined disabled by the Social Security Administration, or folks that have end-stage renal disease. So we have approximately 59 million nationally. In Pennsylvania, we're a little over 2,650,000 Medicare beneficiaries. So you can see that this is a huge undertaking, and we need all of our partners to be informed about it, because our partners are very often those very trusted sources of information and assistance in the community to those people that we serve. So we want our beneficiaries to feel like they can come to you and get questions answered. I will share with you my name and my email in case you have questions as this gets rolled out. I'm happy to serve as a point of contact so that I can answer those for you, and you can continue to be a good source of information to your clients. So I mentioned that there was some legislation, and it was the Medicare Access and CHIP Reauthorization Act, and in parentheses you'll see the acronym MACRA. We are very fond of our acronyms. We use them a lot. It was legislation that was signed in 2015, and since that time, CMS has been involved in working with all of our vendors, all the contractors that pay the claims, all Social Security. There are about 75 different systems, 75 to 90, depending on, I guess, any given day and the circumstances. But all those different systems interact with ours. And so the last 2 years, there's been a lot of behind-the-scenes work being done to get ready for this. Right now, Medicare beneficiaries use something called a HICN, a health insurance claim number. A HICN is an identification number. Usually it's the Social Security number. In fact, it often is either their number or their spouse's number. And that number is used as a way of processing claims and determining eligibility for services across a variety of entities, not just for Medicare, but also for Social Security, for railroad retirement, for Medicaids in the state, for any of the HMOs and PPOs that are Medicare HMOs and PPOs. So a lot of different organizations and agencies use that HICN, and all of them have to be ready and up and going by April 1st to now accept a new identifier, which we are calling the Medicare Beneficiary Identifier, or MBI. So this macro legislation required CMS to have this done by April of 2019. So as I said, benefits won't change. People can start using their cards as soon as they get them. But we are rolling this out in waves because, as I said, 59 million folks is a lot of folks, and we need to do it. We're trying to do it in what we call waves. So by different regions, people will get mailings to their home, and I'll tell you more about it. But this is what the card looks like. This card currently, you probably can't see it on the slide, but it is both in English and Spanish. So it has name and it has Medicare Beneficiary Identifier. And you'll see where the red arrow is pointing, there's an 11-byte identifier that's a combination of both letters and numbers. It is a totally random process, although certain key positions will always be alphabet. So it, as indicated here, positions 2, 5, 8, and 9 will always be alphabet, and those positions will always be capitalized. The alphabet letters are always going to be capitalized. The others, other than 2, 5, 8, and 6, will be just any random combination of letters or numbers. And everybody will get a unique one. It will be unique to them. So husbands and wives will not have the same number. In some cases now, their HICN can be the same with a different alphabet letter at the end. That's not going to be the case. Everybody will get their own number. So it's unique to them, but it is also not intelligent. And by not intelligent, we mean there's nothing here that represents or means anything specific. So it's just a total random number. And then underneath that number, you'll see Hospital Part A and Medical Part B. So those are the different parts of Medicare, and it will tell you on the card what that Medicare beneficiary is entitled to and the date that they're entitled. So, for instance, this one says Medicare Hospital Part A, effective 3/1/2016, and the same with the Medicare Part B, which is your outpatient laboratory, durable medical equipment, preventive health screens. Those are Part B services, and this person's Medicare Part B was effective 3/1/2016. Now, I will say to you that we are seeing more and more, and it's not uncommon, to have the A and the B dates differ. Some people turn on their Part A as soon as they turn 65, but if they continue to work and they have their employer-based health insurance from a current employment, they may delay turning on Part B because they would check with their employer, and their employer would say to them, no, your Medicare, right now your employer coverage is primary until you stop working, and then they would go on to Medicare Part B. So the point being that while the dates are the same here, they may not always be the same. So we are starting to send cards in April of 2018. In the month of April, anybody that is turning 65 and new to Medicare will get the new Medicare card. So the card that they'll get will be just the new one with their new Medicare Beneficiary Identifier on it, as I demonstrated in the previous slide. And that would be anywhere across the country. So anywhere in the United States, when somebody's turning on their Medicare and they decide they want to sign up, when they sign up starting April 1st, they're going to get the new card. Shortly after that, we will start going into what we call geographic waves, where folks in one designated area will be getting their cards for over a couple of months, really, before we go into a new wave. So the folks that will be getting the cards will be people who are new to Medicare and then existing Medicare beneficiaries. So starting in May, people who are currently on Medicare will start to get theirs based on their geographic wave. And I'm going to give you a slide that will show you those geographic waves. It will be, random. And so not everybody will get their card on the same day. In fact, spouses in the same household may differ by days, maybe even weeks, but they will be in the same wave. They'll be in the same geographic wave. So there is a website that Medicare beneficiaries currently use where they can get lots of information and find out about their coverage and learn about claims and learn about if they have a question about durable medical equipment or diabetic supplies. All the coverages are listed there, and that website is medicare.gov. Starting I believe it's the end of this month, Medicare beneficiaries will be able to go to medicare.gov and sign up to get email alerts so that they can get emailed when cards are being distributed in their geographic area. So once folks do get their new Medicare card, they should begin to use it. They should make sure that their providers and their doctors have their new number. The next time they go to their doctor, they would show their new Medicare card with their new identifier on it. There'll be a period of time where if they forgot their card, they could still use the old number. So there is a transition period where a provider can use either their current HICN, the health insurance number that they have now, or the new Medicare Beneficiary Identifier. And so there's a 21-month transition period. But we do encourage folks to begin to use the new card as soon as they get it and to make sure that their providers have that information. And when they do get that new card, after they've made sure that their provider has it, they should shred their old card. And we want to make sure that people know if they don't have access to a shredder, just cut that Social Security number out and cut it up several times, not throw it in a dumpster. We're not trying to encourage any dumpster diving. We want to be very careful about fraudulent activity because we know it's already being reported in some places. So, and beginning January of 2020, January 1st, folks will only be able to use their new card. So we want to make sure that they have it and that they've shared their number with their Medicare providers. So this is a revision of the mailing strategy. I talked about the geographic waves. You can see here that everybody nationwide who is new to Medicare will get the new card starting in April. And then in May we begin rolling out, and we roll out in the region that I represent, which is Region 3, and that is the Delaware, District of Columbia, Maryland, Pennsylvania, Virginia, and West Virginia. So Pennsylvania is one of the first up for receiving their new cards. And we wanted to make sure that we inform as many partners, and we're asking our partners to inform their partners so that Medicare beneficiaries are made aware of this by, like I said, their trusted information intermediaries. And so you can see the different geographic locations on this slide. If you were to, and as the waves begin, this mailing strategy may get tweaked a little bit to be a little more specific, because as you can see, after wave 1 and 2, it just says after June. So it'll begin to fill in as the mailing begins to take off. So the next couple of slides, I just want to show you what it's going to look like, because we want to make sure that folks understand what they're getting, and that you understand. You can tell folks what to look for. We also want to make you aware that while the information is being presented in English, we do have a number of languages that are available. So we make sure that folks know that some of the languages you'll see listed here, if those are their preferred language, they can have all their information presented to them in that language. I'm going to show you the envelope and the new card, and then some of the instructions that will be accompanying the card. This is a look at the envelope, and I tell you about it because it does say on the back of the envelope, official information from Medicare. It will come, and on the upper left-hand corner, it says Department of Health and Human Services. CMS is one of the operating divisions in the Department of Health and Human Services, so it will be coming from us, and it's a window envelope. And inside that window envelope is the card itself. But by using a window envelope, we've decreased any opportunity for mismatched addresses and names between a label and a card. So the card's right in there, and it will be mailed through the United States Postal Service, so it's coming old-fashioned snail mail. Folks do not need to do anything to get this card. It will be coming to them automatically if they have Medicare. So if they currently have Medicare, it's going to automatically come to them. We do have their address currently, and we do have their date of birth, so we don't need to be calling anybody. And the reason I say that is we've already gotten reports of folks who have reported they received calls saying, in order to get your new Medicare card, we need your Social Security number and date of birth. And they are folks presumably who are attempting to some fraudulent activity, because Medicare already has their date of birth and already has their Social Security number. So we will not be calling. The only time we call a beneficiary is if a beneficiary is, let's say, investigating a claim or has a hearing or appealing a claim, and they ask us to research something and call them back. By their request, we will call back, but otherwise we do not call Medicare beneficiaries. So important information to share with folks. And this is information that you can share with your families, your community, any group that you belong to. So inside that envelope, you're going to see this card. It's perforated, so the card is on the right-hand side. It's red, white, and blue, very similar to the card that exists today. It's red, white, and blue. The things that we removed that are different from the card today, we took off the gender and we took off the signature. We don't use them, so we've removed them for a cleaner look. On the back of this card, there are some instructions, and there's also the 800 Medicare number. And I should mention to you that 1-800-MEDICARE is a 24-hour, 7-day-a-week phone line. So even if you have questions about Medicare, or you're working with clients that have questions, you can call that number and you can ask a customer service representative any question that you'd like. On the left-hand side here is just an explanation of what this is, and on the back of the card there are instructions, as I said. And also inside that envelope will be a letter. This is the same letter. One side is English, one side is Spanish. So it will be provided in English and Spanish, but there's also information that says if you need this in other languages. So the back of the letter will say if you need this in other languages, and it gives them instructions and a language line that they can call, and it's written in several different languages so folks can get those instructions. So there are some folks that do prefer to have their Medicare information received in an alternative format. And by alternative format, it may be Braille, it may be large print. They may need some visual stuff. And we at 1-800-Medicare, they're able to take down your preference. So if you say, I need large print all the time, we can indicate that on your Medicare record, and your material will come to you in large print all the time, including your Medicare handbook that comes out every year. So there are folks are able to get this information in their preferred alternative means as well. So we get this question a lot. What if somebody loses their card? Right now they can call, today you can call Social Security or 1-800-Medicare and get a new card. You will be able to do the same thing with the new card. You'll be able to contact Social Security or contact Medicare or go online. And this is a new feature that we didn't have previously. On Medicare.gov, there is a portal for Medicare beneficiaries called My Medicare. Like many of the health services, we have a portal for people who have Medicare. And they can create an account. Not very difficult. They'll need a username and they'll create a password. And they will be able to go in there and see if their card has been mailed to them. So if their card has been mailed, their Medicare Beneficiary Identifier will automatically populate. If it has not, it won't populate yet, and their old HICN will be in that place. And once their card is mailed, then their record will update and show their new Medicare Beneficiary Identifier. There will be a feature on there that allows beneficiaries to print their own card. So they don't have to call us. They can print their own card. They can print out a couple of them if they need to have more than one for some reason. So now if a person does lose their card, they can still call 1-800-Medicare or Social Security. They don't have to go on the portal. The only time that we would change that Medicare Beneficiary Identifier, we won't change it if they ask for a replacement card. They just lost it. But if they were to indicate that they're a victim of identity theft or that their personal identity or health history has been in any way compromised, then they could request, and we would give them a new Medicare Beneficiary Identifier. So we started doing a lot of outreach, actually the beginning of the year. The end of last year, we started messaging during the open enrollment period that there'll be cards coming in 2018. And in the 2018 handbook, the inside front cover revealed the picture of what the new card would look like. But we really started in January, and we're going full strong by doing national messaging and regional messaging when the region is up for receiving their new cards. So like now, I know Pennsylvania is going to be rolling out sometime in May. I'm looking for partners who have an audience that might want to hear about this. I'm sending out flyers. We have office cards for physician offices, posters. We have a YouTube video. We have a number of things out there which I'll show you about, and making sure that our partners have access to them so they can share them. And we are we're going to be doing all this outreach, and as we get close to May, we're going to be doing some very local outreach. We're going to be doing both earned and earned media. We'll be doing public service announcements, bus placards. We'll be doing some radio media tours and articles and interviews. Consumer interviews with the different stations, whoever is interested. But we will certainly be working the media outlets to try and get more local exposure on this. So here are some of the products that I told you about that we have We have certainly our call center has a number of scripts. They're prepared to answer customer service calls about this, but we have digital, paid, and earned media. We have regional outreach and partnerships that we look to engage as we do our outreach. We have a number of products on our product ordering website. We have a lot of downloadable material that you can just download as you need. We have a one-page flyer that's available, 10 things to know. I think there's a slide in here that I'll show you, but it's available in at least, I think, 9 languages. We have fact sheets, widgets, an informational video on our partner page. We also have tear-offs for provider offices so they can leave them on counters. I did a national conference with the state library associations, and the libraries picked up these pads, said, we'll put them on our checkout desk. You know, as folks check out their library cards, we can have them take one of those. So they're, you know, about 5 by 7, and they're very paper thin, so they're very portable and easy to use. But we have a number of public service announcements that can be used in newsletters. If you have the newsletter that you are interested in inserting something, we can make sure that you have some language for that. And I wanted to show you, this is our partner page. So if you go to cms.gov/new card, you're going to land here. And this page right here, we have different audiences. So we have links for health plans and drug plans. But we also have for healthcare providers, and we have the third one down says partners and employers. So we broke out a lot of our materials by the different audiences who would use them. You can go into any of those, of course, but we sort of segregated the material by the audience that organization would serve. And here on the partner page, if you were to click on that partner page, you will find a number of things that you can just click on, flyers, tear-offs, the 10 things to know about the Medicare card is in here in all these languages. A video is right here, so click on it. The video pops open. It's in English. We're looking at having it done in Spanish, but right now it's only available in English. And that video can be used in waiting rooms. I know Social Security offices are using them. Some provider offices are using them. So if you have a computer that you can just pop it on, it's a looping animated video that tells consumers that new cards are coming and what to look for. Here's the 10 things to know about the new Medicare card. They did a nice job about getting a lot of information on one sheet. This is the video that I mentioned to you that's available on YouTube, currently only in English, but you might be able to use it. So here's a comparison of the old card and the new card. And you can see here, this is where the Social Security number was, and in the same location, we're going to be using that identifier. We moved this 1-800 number to the back, but everything else pretty much looks the same. Took out the signature line. And these are just conference cards that we have available for folks, and here are the websites that folks can use and I'm going to give you my email address, because if you have a particular question or you want to know, you have a newsletter or a website, you can put some wording on it and you don't know where to go to get the wording, I'm happy to direct you on. I get pretty familiar with the websites because I use them much more frequently probably than you do. My email address is Debbie, D-E-B-B-I-E, dot, and my last name, which is Feierman, F as in Frank, E-I-E-R-M-A-N, at CMS. So that's Cat Mary Sam, CMS, dot H-H-S, as in Sam, .gov. And my phone number, my direct line is 215-861-4297. I'm happy to take a call. I'm usually there when I'm not out doing outreach, but I pick up my messages frequently. So the key messages that I want to leave you with, really, I said we are using getting these mailed to folks' homes, and we do so by using the address that Medicare beneficiaries have on file at the Social Security office. So if you are working with anybody, please make sure that they have their address correct on the Social Security file. Sometimes people move, and because they have direct deposit, they don't think to update that address, but that is the address we'll be using. Also, for folks who do not have a home and are homeless, they will need to have the address of a shelter or some address that it can be mailed to in order to receive their card at this time. It will be coming through U.S. Postal, so they won't have to do anything. And if they do get any calls saying we need to confirm, please tell them to just hang up. That would not be us. I did tell you that there's no change in benefits, and there should be no disruption to service. We do have a 21-month transition period where providers can use either their current number or their new number. And then starting in June, we'll have a mechanism in place for doctors, providers to be able to look up a beneficiary or a consumer or their patient's new number if the person comes to the office and forgot their card. There'll be a way for them to go into a provider system and retrieve the consumer's number. So it should not disrupt any services. And once they receive their new card, they should destroy their old one and shred it. By destroy, we mean shred, make sure that number is not on there. If they're not comfortable doing that, I've been told that there are Medicare beneficiaries that will never give up that original Social Security card. So if that's the case, we would suggest that they at least take a Sharpie and black out everything maybe but the last four numbers, but we really don't want them carrying that around any longer than they have to. And we want to make sure that folks are alert and watch out for scams. So with that, I'm happy to take any questions that you may have. Colleen, if you would open up the lines.
Sure, and then there was one question that came in the chat box. Do you recommend
about
that?
Laminating the cards?
Mm-hmm.
Yeah, thank you for that question. It's an excellent question, and we get that often. So we do not have any rules against lamination. Folks can laminate the card. We've been told by providers that sometimes the lamination does not allow them to scan those cards, so they have some difficulty with it. So I would suggest that when you get your card, take it to the doctor when you go the next time, or your provider or durable medical equipment person or a specialist. Make sure they have it, they can scan it, and then you can certainly feel free to go ahead and laminate it. It would only be a problem if the provider couldn't retrieve the number. Now again, the person would be able to go into My Medicare account and download another one if that lamination in the future prevented somebody from actually being able to scan it.
Okay, and I'm going to unmute the line.
The conference has been unmuted.
So if anybody has a question now to ask Debbie, you can comment now or also use the chat box feature.
And while you're doing that, I'll give you my email address again. It's DEBBIE dot S as in Frank, EIERMAN at cms.hhs.gov, and my phone number is 215-861-4297. So it looks like Vicki said you mentioned partner events. What if I'm interested in hosting one of those? And thank you for that inquiry, Vicki, and we are happy to talk with you about that. I would suggest you either email me or call me and let me know, what you're thinking about, what opportunities you have for us to present, and we'll certainly be glad to, consider that, see where it is, and if we're able to, we'll fulfill it. If not, we'll see if we can get somebody to fulfill it. At the very least, we can make sure you have materials for any of your meetings And whatever you can carry out, if you are going, even in your own communities, if you are part of a faith community and you want to make sure people have information, or you're doing a newsletter for your organization, you can drop a short paragraph in. Please just shoot me an email and I'm happy to work with you on that.
And we did have a question about the presentation being available online, and we are recording today's webinar, so the webinar will be sent out early next week along with the slides as well as resources that Debbie had provided through the registration of this webinar.
Thank you, Colleen. And I should mention, too, that at cms.gov/new card, if you click on Partner, you'll find there is a generic presentation out there. It will look very similar to the one I used here. It is for partners to be able to use when they go out, if they do any presentations or want to modify this presentation. I will repeat my email address. Which is Debbie, Debbie, dot, my last name, which is Feierman, F as in Frank, Eierman, so it's Debbie.Feierman at cms.hhs, as in Sam, .gov. So Centers for Medicare Services HHS, which is Health and Human Services, .gov for government. Okay. Last call for questions. If there are none, I'll give you back some of your day.
Great. Thank you so much, Debbie, for presenting and sharing this information with us, and we really appreciate it.
Thank you for having us. We appreciate the opportunity and your partnership in this.
Thank you, everyone, for joining the webinar today. As mentioned, a recording of the webinar, slides, and additional resources will be sent out early next week to follow up the webinar. And have a great weekend.